Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. Here are some of the highlights this hour. Presidential Task Force on COVID-19 gives its midterm review of the coronavirus pandemic fight in the country, calls for better adherence to safety protocols. As COVID-19 cases rise across Nigeria, Ekiti State government launches health insurance scheme to commence renovation of primary healthcare facilities. And World Health Organization chief says too many countries are headed in the wrong direction, warns on mixed messages from leaders on the coronavirus pandemic. According to the Nigeria Center for Disease Control (NCDC), 16 deaths were recorded in the last 24 hours in 4 states: Lagos, the FCT, Enugu, and Gombe. The death toll in Lagos State rises to 172 after the state recorded 12 deaths in 24 hours. Lagos, currently the epicenter of the virus in Nigeria, has 10,358 active cases after 152 new cases were confirmed last night. Total confirmed cases in Nigeria stands at 32,558, out of which 21,385 are male and 11,173 are females. The most affected age group is still between 31 to 40. Also, in the last 24 hours, 344 cases were discharged in 14 states. A breakdown of the regional figures show Lagos leading in the southwest with 12,427 confirmed cases, the FCT in the north central, the northwest, and that's Kano with 1,309 cases. In the south-south, you have Rivers topping that region, and Ebonyi leads in the southeast with 616 confirmed cases. The Presidential Task Force on COVID-19 has presented its midterm report on activities identifying a number of gaps to be filled in the national response to the coronavirus pandemic. The chairman of the task force and secretary to the government of the Federation, Mr. Boss Mustafa, among other factors, highlights some deficits in the response activities to include the area of case management, testing capacity, risk communication, state ownership, and collaboration.
We institutionalize IPC policies in healthcare facilities and take steps to increase compliance of non-pharmaceutical measures, especially the use of masks in public places, hand washing and the use of hand sanitizers, and the observance of physical or social distancing. We will continue to increase engagement with the private sector. In spite of the losses as a result of the pandemic, we believe that we need to support local production of PPEs and other critical supplies in the country. 9, movement post-easing of lockdowns. Here, the course of action is communicating that anyone above 60 years or persons with morbidities such as hypertension, diabetes, autoimmune disorders, cancers, etc., should stay at home and avoid social events as they are at highest risk of infection and mortality. Post-PTF national response. The course of action here is to develop an exit strategy beyond the life of the PTF, that is beyond September 2020.
Chairman of the Presidential Task Force.
On his part, the Minister of Health, Dr. Sage Hanire, announces that research activities into the treatments for COVID-19 in Nigeria is showing some promise.
News of the development of an RNA extraction kit and its validation has been relayed to me from our research centers. I'm very proud of this development which I have asked NCDC to evaluate because it will be a further step in reducing the dependence on imported commodities. I hope our researchers will continue with this trend and can be assured of the report of the Federal Ministry of Health. The National Institute for Pharmaceutical Research and Development has also applied for financial support to continue its research on the efficacy of Artemisia annua combination in the treatment of COVID-19, which I hope will resonate with research sponsors. NAFDAC recently also gave a report on a traditional herbal medicine that it looked into, which provide information on safety for use. But that report does not cover efficacy. The difference must be made very clear.
Following the effect of the coronavirus pandemic on healthcare systems around the world in Nigeria, the Ekiti State government is providing more qualitative and affordable healthcare to the people of the state with the launch of the state's health insurance scheme. The governor, Dr. Kayode Fayemi, while launching the scheme, says the state will commence the renovation and equipping of primary healthcare facilities across Ekiti State.
As we all know, health insurance guarantees unlimited health care funding with a view to achieving universal health care coverage with little or no financial burden on both the government and the people of the state. The mission of this scheme, therefore, is to put in place appropriate health plans and programs that will ensure continuous access to all Ekiti residents to qualitative and affordable healthcare services through collective pooling and redistribution of our financial resources. I am therefore confident that this program will ensure protection of the family from financial hardship of huge medical bills, ensure sound health of our children, and safe delivery of our pregnant mothers.
Now, on the global research to establish whether or not COVID-19 can be airborne, the Director General of the Nigeria Center for Disease Control, Dr. Chikwe Hekwazu, says that in today's briefing, it cannot be ruled out as new evidence emerges and guides the national COVID-19 response. We have Dr. Aboyowa Edukugo. He's a field epidemiologist, African Field Epidemiology Network, Afrinet. He joins us from Abuja studios. Thank you for joining us at this time. I'd first like to begin with your thoughts on the growing scientific and the evidence of COVID-19 as being airborne, an airborne infection. If there is this increasing evidence, are we fighting the virus the right way?
Okay, thank you, Melissa, and thank you for having me. Like it's been said over the time that this is new. The disease is new, and the virus is also new. And so every day, researches are ongoing to get more facts and more facts about how the disease is evolving and is growing. And of course, these facts that we get every day helps us to be able to attack and tackle the disease as it goes. So from reports, it looks like since we have more transmission, more community transmission, even at this time, it looks like there's something that is bigger than just the air droplet that we have always known about. But of course, so since researches are going on, it looks we'll be able to get more evidence to be able to see how to control the disease better.
All right. Now, the Presidential Task Force has been giving its brief sort of midterm strategies to the COVID-19 fights, highlighting some deficits in the response as well. How would you score them?
Well, the Presidential Task Force is not working based on on just they are working on facts. They are working on evidence. They are working with scientists. They are working with people who are doing researches. And of course, as you go on in this fight of fighting against the virus, you need evidence to be able to prove, to be able to get through and get success in what you do. So the gaps they have identified is not their fault. It's because the virus is evolving. A lot of things are going on. Like I said, researches all over the world, research over in the country, and new evidences that bring to bear what should be done will always supersede what has been done before. So as it were, yes, there are gaps, but of course, when you recognize that gaps are there, what you do is to be able to fill them. And with what is being said, what is being known about this time, those gaps will be filled appropriately.
What do you think we need to improve in our response? The WHO was briefing today and talked about how some governments and leaders across the world are sending mixed signals, and that might be hampering the fight towards curbing the spread of the pandemic.
Well, I think that people have to be very careful with the source of information or where they get their information from. There's across the world, across the globe, we know that WHO website is important, and that will give information that is needed. And also in our country here in Nigeria, the NCDC website, the microsite, the COVID microsite is a very important place where source of information to get on COVID. So let's not look for information where information cannot be found. Don't just look. Anybody can wake up and post things on social media. But when you want to get authentic information, you go to the right place to get this information. For us, like I said, NCDC website, they have the COVID microsite. It's a very good source of information. I think the state house also has its website, and we can also go there. The WHO website is also rich in information. So when we do this, we should get information from the right sources and not just anyone. People post things they want to post, but getting the right information, we give you the right steps to be able to address and control this disease.
Indeed, information is key, but also when it comes to funding, is there an economic cost of not providing adequate funding? And if we look at from the angle of frontline or last line workers, we've seen health workers across Nigeria at different times in the pandemic cry of being owed salaries or salary slash or poor insurance or lack of hazard allowances. I mean, the list goes on and on. Why would you think this is still a problem? And, do you see us going past this?
Oh, like we all know, I think the federal government is at it, and it's working from what the presidential task force, when the Minister of Health was talking, I think he mentioned, for him, I think he felt he was surprised by the people who have not been paid, and he has made adequate provision for people to be able to write to him directly, and he will see to all of these things. And I want to believe, and I know that the government is working at the federal, at the state level to be able to see to the welfare of these frontline workers. Like we all know, we all said this just came as an emergency, and of course funds are being pulled everywhere to be able to control and to be able to attack this pandemic that we have. And of course the health system is not also left out of it. So, but I know there are good efforts in the right direction to be able to see that things move smoothly. Funds are being generated, are being pulled out, and pulled into the sector to be able to see that the welfare of the frontline workers is adequately taken care of. And we must note that it's not just about the funds. The welfare of workers goes just beyond the funds. It's also talking about their safety in the hospitals, in the primary healthcare center. And of course, we know that recently, about a month ago, the MPACDA conducted a training to show the IPC training to see how health workers also can be protected when rendering these services at that particular level. So there was the training is going on across the level from the national to the state and to the local government level, even to the ward levels, to see how health workers can be protected when also rendering their services. So the welfare does not just talk about money alone. It talks about so many other things that are going at the background that people are not really aware of.
We'd like to thank you. Thank you so much, Dr. Aboyowa Edukugo, Field Epidemiologist, African Field Epidemiology Network. We'd like to thank you for joining us at this time.
Thank you for having me.
Stay with us. We have more on the COVID-19 updates. The Nigerian Medical Association, NMA, says that at least 35 doctors in Kwara State have tested positive to COVID-19 since the virus broke out in the state. The Kwara State NMA chairman, Dr. Kolade Sholagberu, explains that in spite of the rising cases, the association has not recorded any casualty amongst its members. He, however, cautioned residents to disregard the beliefs that COVID-19 is not real.
In Kwara State, between 30 and 35 of our members have been affected by COVID-19, and they were treated at the isolation center, Sobi Specialist Hospital, now designated as COVID-19 and Infectious Disease Center. We thank the government, particularly led by the chairman of the COVID-19 Technical Committee, Mr. Kayode Alabi, who actually also pay a visit to them individually and to their family as a way of also giving them support.
A medical laboratory scientist, medical virologist, Dr. Solomon Cholom, he joins us from Abuja studios. I'm just being told now that we're still waiting for him to join us. But let's tell you what the World Health Organization at its briefing today said, warning that the pandemic, COVID-19, is getting worse. It says that if certain governments do not take decisive action to curb the spread of the virus, the Director General of the Health Agency, Dr. Tedros Ghebreyesus, says countries are moving in the wrong direction as the actions of many governments and people do not reflect that they consider the virus public enemy number one.
Let me be blunt. Too many countries are headed in the wrong direction. The virus remains public enemy number one. But the actions of many governments and people do not reflect of this. The only aim of the virus is to find people to infect. Mixed messages from leaders are undermining the most critical ingredient of any response: trust. If governments do not clearly communicate with their citizens and roll out a comprehensive strategy focused on suppressing transmission and saving lives, if populations do not follow the basic public health principles of physical distancing, hand washing, wearing masks, coughing etiquette, and staying at home when sick, if the basics aren't followed, there is only one way this pandemic is going to go. It's going to get worse and worse and worse.
He did further talk about the focus on reducing mortality, suppressing the transmission, empowering and also engaging the community, and strong government leadership, coordination of strategies, and this is across board. But more on the pandemic is that Latin America has become the second worst affected region by the pandemic, taking over the US and Canada. According to reports, almost 145,000 people have died there from the pandemic, with half of them in Brazil. Now, the deaths in Mexico passing 35,000 puts it fourth highest in the global debt.
Mexico has surpassed Italy to become the country with the fourth highest coronavirus death toll in the world. On Sunday, the country recorded 276 additional fatalities and 4,482 new infections to bring its coronavirus death toll to 35,000, with 299,750 confirmed cases. Italy has recorded 34,954 deaths and 243,061 cases. Mexico trails the United States, Brazil, and the UK in total deaths. Argentina exceeded 100,000 cases of COVID-19 over the weekend as it struggles to contain spiraling case rates despite a strict quarantine imposed on the capital and its surroundings. The country saw 2,657 new cases confirmed overnight, taking the country's total to 100,166. The regional government in Catalonia, Spain, decided on Sunday to reimpose lockdown measures from today in the city of Lleida and 7 other areas due to surging cases. Catalonia has recorded over 76,000 of the country's 253,908 confirmed cases, and the death toll sits just over 28,000. According to Germany's health minister Jens Spahn, Germany can prevent a second wave of the coronavirus in the autumn period if people stay vigilant, particularly during the summer vacation season. Spahn told a news conference it was important to remain alert when traveling abroad and said he was worried by pictures showing holidaymakers partying in Mallorca at the weekend and ignoring social distancing rules.
I have to say that the pictures we saw this weekend at Germany's most beloved island, Mallorca, worry me. I must say I understand the impatience. But where there are parties, the infection risk is particularly high. We don't automatically have to expect a second wave in the autumn and winter. Together as a society, we can prevent that, as we did once before, breaking the wave and keeping the pandemic in check.
And Australia's most populous state found 14 new cases of COVID-19 as the cluster near Sydney stoked fears of a second national wave of the virus. In Victoria State, authorities said they have found 177 new cases in the last 24 hours, the 8th consecutive day of triple-digit rises in COVID-19 cases. Australia has avoided the high COVID-19 casualty numbers of other nations with swift and strict measures. However, authorities are worried about rising cases of community transmission.
ncdc.gov.ng is a website you can find the latest national strategy on flattening the curve. The website comes alive with all the information, statistics, regular updates on the guidelines on how you can also efficiently isolate yourself, what it means by social distancing. You can access also emergency contacts if you need to. And from the World Health Organization, the live feed has regular updates about the spread of the pandemic, the reach across the country, across the world rather. It also gives us the COVID-19 strategy guides, the public health response at both national and sub-national levels. You can take a closer look at the practical guidance for strategic action. Channelcv.com is our website. You can take a closer look at some of the information coming in. There is that of the pandemic and what we're seeing there with regards to the legislature. Several other stories coming in across the country from Africa and the rest of the world. That's a COVID-19 update. Thank you for watching. I'm Millicent Walker. Stay healthy, stay safe.
COVID-19, a new strain of virus from the family of coronaviruses, has been recorded in over 200 countries, areas, and territories around the world. The highly infectious virus is transmitted primarily via droplets of saliva or discharge from the nose of an infected person through coughing or sneezing. These droplets can then be acquired by anyone in close contact through breathing in the droplets or by touching objects and surfaces with the droplets and then touching the nose, mouth, or eyes. While it's been said that some infected persons may not display symptoms, common signs of COVID-19 infection include dry cough, fever, sore throat or diarrhea, and difficulty in breathing. Do you or someone close to you have these symptoms? Call the following numbers.
The Channels 24 app means you'll always be in touch with the news. Get the latest local and international stories on the go. And there's our social media platforms for news from around the world. Watch the news live and play videos that matter to you. You can also check the eyewitness section to report events around you. Just click on the eyewitness icon and follow the instructions to upload your content. Channels 24 app, the news at your fingertips.
Relationship with him, you don't have to do all that introduction because he knows your voice.
This is the era of science. Because there'll be a shaking of the world, massive volcanic eruption, there'll be serious distortion of nature. 2011 is going to be a year the world is shaken. Nature will react violently. Places that never knew flooding will know it. 2013 may be quite a challenge for a former prime minister. This is the season of change. We need Jesus to take over his church and do what only him can do.
What manner of man is this? He's your savior. He's your father.
We'll pray for the sick. Legs will grow out. Limbs will grow out. Eyes will open. Favor will rest on you. Breakthrough will come on you.
does not matter what may be going on in your life right now. It's just a matter of time. I said it's just a matter of time. This too shall pass in the name of Jesus. And then Dr. Sam talks about the plow of perseverance and the mantle of provision. And he said, what heaven starts, hell cannot stop it. And I want to remind you once again this morning that what heaven has started in your life, hell cannot stop it. I said hell cannot stop it, because today's plow pushers are tomorrow's mantle carrier. And it's time for you to not settle for less than God, what God has for you.